I'm Dr. Cecil Bennett. If one had to choose one sector of healthcare that has come under significant scrutiny, increased regulation, and decreased reimbursement, it would be lab services. One cannot deny, though, the importance of lab diagnostic testing. They are necessary tools to evaluate and manage our patients appropriately. In the toxicology space, major changes in reimbursement requirements have significantly driven down revenues over the past few years. There's also been less insurers willing to pay for these tests for our patient populations. The current toxicology panel is limited and only covers small segments of drugs that patients are taking. As a primary care physician, I wanted something a little bit more robust. I wanted to have a significant urinalysis tool that not only covered pain medications, but other critical medications in primary care. A urinalysis tool that screened patients for medications for blood pressure, diabetes, high cholesterol, heart disease, and other mental health disorders. If current LC-MS technology could do a quantitative analysis of a sample for morphine, I wanted it to do the same thing for metformin. If it could do it for Percocet, I wanted to do it for Paxil. If I could check to see whether or not my patient was taking Lortab, I want to see if they were compliant with a lisinopril. Over the last few years, I have developed such a comprehensive screening tool. It is called the Bennett Polypharmacy Profile, or BPP. The BPP is the most comprehensive urinalysis screening tool for not only pain medicines and other drugs of abuse, but also for the most common drugs prescribed today in primary care. Whether you are a lab that currently does toxicology testing or not, the BPP panel is another tool you can add to your current diagnostic product line. Our objective is to license the BPP to clinical laboratories so that they can offer it to their providers or their customer base. The BPPs allows you to target a primary care population you did not have access to before. From a reimbursement standpoint, the BPP covers 24 classes of medications. Follows the short video of the clinical value of the Bennett Polypharmacy Profile. The BPP utilizes the same LC-MS technology used in UDS or urine drug screens with proven sensitivity and specificity of greater than 95%. Let's look at how the BPP can help you in your practice. The Bennett Polypharmacy Profile. The Bennett Polypharmacy Profile is a unique urinalysis of the most common drugs prescribed by physicians. And again, it's a simple urinalysis that covers the following classes: blood pressure, cholesterol, cardiac medications, over-the-counter pain medications, some herbal supplements, migraine medications, and psychiatric medications or mental health-related medications. This is an example of some of the medications available on the Bennett Polypharmacy Profile. Just to look at the headings: blood pressure, the most common drugs used in blood pressure control today; diabetes, common drugs used in diabetes. In your bottom right-hand section, the SSRIs and other antidepressants and drugs used in mental health are here as well. And above that, there's some psychiatric and related drugs that are available for evaluation on the BPP. Let's look at some results. Here are actual results of patients that have been screened using the Bennett Polypharmacy Profile. This patient was born in 1938. It's a female patient. The top section shows the patient has taken alprazolam, amlodipine, and several other drugs. Below that, you'll see a green section. In that green section, it tells you what medication the patient is taking that actually is in their system. In this case, the metformin is present, hydrochlorothiazide is present, lisinopril is present. If you look at the first red section, this tells you which medications were prescribed that were negative in the patient's system. In this case, the patient was not taking alprazolam. Now, this could be PRN, so that may not mean a whole lot for alprazolam. But what's alarming is that this patient is negative for glipizide for their blood sugar, they're negative for amlodipine for their blood pressure, and they're negative for their atenolol. This is a patient you would have to bring back into the office and find out exactly what's going on. Was the patient referred to a specialist and their medications were changed? Is the patient non-compliant? But clearly there is some intervention warranted in this patient. So when looking at the different mechanisms of action of different medications you can use, when you're looking at, for instance, the effect of beta blockers, that would affect heart rate by decreasing heart rate and therefore decreasing blood pressure control. I've been an educator or in family medicine for 20 years this year. I enjoy collaborating with my peers on issues that improve the quality of life of my patients. I believe the BPP is such a tool that can actually make a tremendous difference in reducing morbidity and mortality in our patients. Well, I've been asked, has the BPP been proven in studies to reduce morbidity and mortality in patients who are non-compliant? And my response is this. Just like the blood pressure cuff or a glucose meter, the BPP is just a tool that gives you an objective measurement. It is up to us, the provider, to use that tool to better serve our patients. For questions of how you can obtain a BPP methodology licensing agreement if you are a toxicology lab, or obtain a lab-to-lab agreement with one of our lab partners that processes the BPP, our contact information will be listed at the end of this video. We look forward to working with you to bring this revolutionary polypharmacy and medication compliance tool to your providers.